My name is David Pennington. I'm a clinical research psychologist and associate director of the addiction research program at the San Francisco VA healthcare system. I'm also an assistant professor in the Department of Psychiatry at UCSF. What excites me about my job is I get to do a lot of different and really interesting things. I get to study cognitive remediation interventions for substance use disorders. I get to examine how those interventions relate to neurobiology. And I also get to travel to rural areas in order to try and figure out how to better deliver medical services to underserved veterans. It's really the most ideal job that I could imagine. So in the addiction research program, we're working on leveraging virtual reality technology in order to enhance cognitive remediation interventions. We're trying to make these interventions as engaging and exciting as possible in order to increase compliance and boost efficacy. We're also developing some safe VR environments so patients can practice strengthening their coping skills related to being in high-risk situations for drug and alcohol use. Clinically, we're trying to make sure that these tools are accessible more broadly. We want to make sure that veterans living in rural areas are able to access these therapeutic tools as easily as somebody living in a major metropolitan area. At this point, a lot of these projects are in early development or in pilot testing. And so for the future, what we really want to do is take these to larger clinical trials and eventually have this become part of regular clinical practice. Our work directly impacts underserved populations because our focus is to develop new clinical interventions that are able to reach rural areas and help underserved veterans who are struggling with substance use disorders. Our group collaborates with the Department of Radiology at UCSF in order to complete some of the neuroimaging aspects of our research. We've also asked for consultation from the Digital Health Core at UCSF in order to help us solve some of the problems that we've had with developing VR environments and mobile health apps in general. We've also partnered with a number of companies in the Bay Area and actually across the U.S. Who have been interested in partnering with the healthcare industry. We have also established a lot of collaborations with international investigators in the Netherlands and in Australia who have really been instrumental in helping us further refine and develop our cognitive remediation interventions. Our team exemplifies UCSF's pride values because we're trying to be accountable and we're just really trying to do what's right for the veterans that we serve. I feel really privileged to be in the position that I am, and I'm really proud to serve the veterans and their families who have really sacrificed so much for all of us. Being named a John A. Watson Scholar means to me that the institutions that I represent are not only interested and invested in my future, but they're invested in the future of the underserved veterans who we're trying to serve.